Now, using our 3 steps, let's break this down. This question's asking what med to question regarding the key problem: worsening crackles in the lungs, sudden JVD, we're thinking fluid retention, new pedal edema, again guys, fluid retention, as well as low O2 saturation. So this question already is screaming fluid volume overload and heart failure. So the memory trick we use is HF for heart failure, HF for this heavy fluid. Technically, this patient is an exacerbated acute or worsening heart failure. And how do we know that? The key words inside the question: worsening, sudden, and new. These are NCLEX keywords talking about a worsening or an acute phase here. So the question we're asking ourselves is, what kills the patient first? And really what kills the patient first is this fluid, and fluid inside the lungs called pulmonary edema. So the solution we're looking for is that the med that are not appropriate for the worsening heart failure. And we're already thinking over-the-counter drugs, because over-the-counter contains sodium, which is swelling the body, as well as beta blockers, which are bad for worsening heart failure. So now let's address our options here. Option number 1 is incorrect. Aspirin is an antiplatelet, which is a blood thinner. It doesn't affect worsening heart failure. Option 2 and 3 are both incorrect as well, because simvastatin is a cholesterol lowering drug. Again, guys, doesn't affect the heart failure, or really the heart at all. And option 3, torsemide, helps drain the fluid. Remember, it's an ide-ending drug, which makes the body dried from fluid as well as potassium. So that's actually the medication that we would give this patient right now for this heart failure. But option number 4 is what we want to avoid, so we have to choose it here as the correct option. So beta blockers, remember, are bad for worsening heart failure, as well as bad for asthmatic patients. So we have to choose this as the most correct option. Okay, that wraps it up. For more details and test tips, please see our rationale below. Now, using our 3 steps, let's break this down. This question's asking for which patient to report for the key problem: nitro titrated drip has been started. So before looking at the options, we're thinking nitro is a vasodilator that helps with hypertension. So it basically dilates the vessels to lower the blood pressure and might even lead to hypotension. So the biggest risk for safety here is dizziness when standing and falls. So that orthostatic hypotension. So we're just looking to keep the patient safe with slow position changes with nitro. So the solution we're looking for are priority signs and symptoms the patient is experiencing. So option number 1 is incorrect. Shortness of breath with running in place. Now, first off, why are you running in place with a nitro drip? That's crazy. And what the heck are we thinking here? But technically, shortness of breath with activity is to be expected. So option 1 is incorrect here. Now, option number 2, jittery or anxiousness and feeling, guys, that's to be expected, as well as a headache with someone with taking nitro. Now, option 3, this is the worst case scenario because it leads to a patient safety issue. So option 3 is the most correct here, because dizziness upon standing indicates serious hypotension. The patient will fall here. So nitro, guys, remember, is a vasodilator that lowers the blood pressure. So option 3 is our most correct. Now, option 4 is incorrect because chest pain that's relieved with nitro, that's the reason why we're giving it most of the times, as well as lowering the blood pressure. So remember, always ask yourself what kills or harms the patient the fastest, and that is option number 3 here. Okay, that wraps it up. For more details and test tips, please see our using our 3 steps, let's break this down. This question is asking for the most appropriate response for the key problem of Kawasaki's medication plan here. So before looking at the options, we're just thinking about Kawasaki's. So Kawasaki's, we have inflammation of the blood vessels and cardiac complications. So the memory trick we use for Kawasaki's is the Aki's in the blood vessels, which we have increased risk for aneurysm as well as MI, or those heart attacks. So the solution we're looking for are remarks by the nurse about what the treatment plan includes. So option number 1 is incorrect. IVIG, that immunoglobulin, is for inflammation, not for infection here. And option 2 is incorrect. Technically, aspirin is given to help with inflammation from those achy blood vessels and prevent clots, that MI. So guys, I can see if you got this question wrong, we avoid aspirin with Ray's syndrome, not Kawasaki's here. Now, option 3 is correct because drugs are given to reduce coronary artery aneurysms. So remember, Kawasaki's is for those achy blood vessels. And option 4 is incorrect. Kawasaki disease is not a bacterial infection, and it doesn't affect the liver. It affects the cardiovascular system. Okay, that wraps it up. For more details and test tips, please see our rationale below. Now, using our 3 steps, let's break this down. This question is asking for which adverse effect avoided for the key problem, furosemide given IV piggyback over 60 minutes. So before looking at the options, we're thinking this is a slow infusion to avoid this ototoxicity. And ototoxicity, the key sign is tinnitus, which is ringing of the ears here, which indicates a renal function problem. So remember, ide-ending drugs makes the body dried, and this patient pees out a lot from their kidneys. So the memory trick we use for kidney function are the 2 kidneys, we have 2 ears. So ringing in the ears means that 2 kidneys are affected here. So we're looking for ototoxicity or tinnitus. So the solution we're looking for are reasons to give this medication slow. Option number 1 is incorrect. Bradypnea, or that slow breathing, is not an adverse effect of furosemide, or infusing too fast here. And option number 2 was pretty close, but it's incorrect. So hyponatremia, this low sodium, again, not an adverse effect of giving furosemide too fast. And option 3, even closer, but also incorrect. Hypovolemia, this low fluid volume, is not an adverse effect of furosemide infusion or giving it too fast. Now, technically this is correct given more long-term as a long-term diuretic, but it's not an indication of giving the medication too fast. And option 4, normal potassium is not an adverse effect of giving it too fast. Technically, normal potassium is a good thing, right? So that leaves us with option number 5, this ototoxicity of the ears. So that is the biggest adverse effect of giving any furosemide or ide-ending diuretic way too fast. So the loop diuretics given too fast, just think ototoxicity for tinnitus. Okay, that wraps it up. For more details and test tips, please see our rationale below. Now, using our 3 steps, let's break this down. This question's asking which foods for the key problem taking warfarin. So remember, warfarin is a blood thinner, and vitamin K blocks the effects of warfarin. It's the antidote. So it's found in green leafy veggies, that vitamin K. So the memory trick we use is warkin for warfarin. So warkin, just remember W is for warfarin, and warkin, the K, is for vitamin K, the antidote, found in green leafy veggies here. And then lastly, warkin, the IN is for the INR lab value to monitor. Not PTT, but the INR. So the solution we're looking for is, what do we monitor for the intake for this patient? And we're thinking green leafy veggies is for vitamin K foods here. So option 1 is incorrect. Apricots are high in potassium, not in vitamin K, and they're not green or leafy here. Now option 2, kale is a green leafy, high in vitamin K for kale. And option 3, green tea, just let the name help you, green, it's green and leafy here. Now option 4, sauerkraut. This was really tricky because sauerkraut is technically cabbage, and cabbage is green and leafy. And option 5, also correct. Turnips are green. Basically, they have a green leafy stem with vitamin K. And lastly, option number 6 is incorrect here. Raisins aren't green, and they're definitely not leafy. Okay, that wraps it up. For more details and test tips, please see our rationale below. Now, using our 3 steps, let's break this down. This question's asking for incorrect patient statements for the key problem, nitro sublingual tablets. So before looking at the options, we're just thinking nitro is a vasodilator, and sublingual is under the tongue, sublingual. So the memory trick we use is that nitro is that vasodilator that lowers the blood pressure. And guys, we're only giving 3 pills maximum, taken 5 minutes apart. And we call 911 if chest pain persists 5 minutes after the first dose. That's the key number there. Chest pain after the first dose. And some general tips here. We don't swallow anything under the tongue here. So nitro is the biggest medication on the NCLEX that's given sublingual. No swallowing this medication. And we want this medication in the original container. So no pill boxes, no light, no heat, and not on the patient's body because it will generate heat. So in the car or inside a purse is okay here. So the solution we're looking for is incorrect patient statements with nitro. So option number 1 is incorrect. 3 tabs maximum if chest pain persists here. So not 5, but 3 max. Now, option number 2 is the most correct here. So guys, the no-nos of nitro. Tabs should not be inside the pocket because being inside the pocket, we're talking body heat. And we're only doing 3 tabs max, not 5 here. Now, option 3 and 4 are incorrect here. We call 911 if the chest pain persists here. And option number 4 is incorrect. Getting the med will help with chest pain, even if it occurs without exertion. That's known as unstable angina. So just remember, unstable angina is unprovoked by activity. So giving the med will actually help with that right now. So option 4 is incorrect. Okay, that wraps it up. For more details and test tips, please see our rationale below. Now, using our 3 steps, let's break this down. This question's asking for which medication needs to change for the key problem, exacerbation of heart failure with severe edema and weight gain. So before looking at the options, we're thinking retaining fluid, HF for heart failure, we're thinking HF for heavy fluid. Now, before you guys look at the options, you better write this down here. The number 1 drug to help with any type of heavy fluid issue for heart failure is ide-ending diuretics, like furosemide It makes the body dry. So it drains fluid from the body into the body. So the solution we're looking for is the number one medication to give for fluid volume overload. So ide ending. So option number one is the most correct here. Furosemide and even torsodomide or all these ide ending loop diuretics are given for any patient experiencing fluid volume overload. So this needs to be changed and increased for anyone that basically has an increase in fluid volume in their body. Now, option two was pretty close because valsartan is a sartan, an ARB, so we say sartan is a relaxed man. It lowers the blood pressure. Now, it doesn't control fluid retention directly, so I can see if you got mixed up. Technically incorrect. Now, option three is incorrect. Metoprolol is a beta blocker ending in LOL. So beta blockers put the brakes on the heart rate and the blood pressure, but again, it doesn't control fluid retention directly. And option four is incorrect. Isosorbide, technically an ide-ending drug, but remember, let the O's help you. So isoso is so tricky. It's a vasodilator, and technically in the same family of nitro, which lowers the blood pressure, but it does it in a different way. It doesn't affect fluid retention directly. So option one is our most correct option here. Okay, that wraps it up. For more now, using our 3 steps, let's break this down. Cardiac pharmacology 13. This question's asking for incorrect teaching regarding the key problem, food to drug interactions, with a risk of warfarin blocking here. So before looking at the options, we're thinking warfarin is a blood thinner. The patient has a high risk for bleeding, and vitamin K blocks the effects of warfarin, which is the antidote. So we know vitamin K is found in those green leafy veggies here. So the memory trick we use to help you remember this is Warkin for warfarin. So just remember Warkin, so W for warfarin, it lasts a long time, like a war. So we have to do frequent lab checks, and so the patient needs to get their blood drawn a lot. Now Warkin, remember the K is for vitamin K, the antidote, found in those green leafy veggies. And then the last part of Warkin, IN for INR, which is a lab value to monitor. Not PT, that's for heparin. So just remember Warkin. Now the solution we're looking for are incorrect statements. We're thinking high risk for bleeding here. So always remember, think what kills the patient first. And with any blood thinner, the patient can bleed out. So option number one is incorrect. Vitamin K can block warfarin's blood thinning effects, leading to more clots here. And option two, also incorrect. The HCP should be made aware of any over-the-counter natural remedies. This could increase the risk for bleeding here. And option three is correct. Technically, kale is a green leafy, which is high in vitamin K, that blocks the meds, leading to clots. So it's good to avoid these green leafy or excess amounts of green leafy. Not too high, not too low, just a nice even rate. Now option four is incorrect. Blood tests are required when you're on warfarin. Remember, warfarin lasts like a war a long time. So we need to do frequent blood checks. And option five, wear closed-toe shoes. We're thinking risk for injury, increased risk for bleeding if the patient gets. Now using our 3 steps, let's break this down. This question's asking for which indicating activity for the key problem isosobride medication is working for stable angina. So before looking at the options, we're just already thinking no chest pain with activity. So the memory trick we use is stable angina is the stress-induced chest pain. So isosobride, use the O's. It's a vasodilator that decreases chest pain with strenuous activity from that stable angina. So the solution we're looking for are findings that the patient is able to perform strenuous activity without any chest pain, without that angina, that achiness in the chest. So option number 1 is incorrect here. Minimal episodes of increased heart rate and respiratory rate, guys, that doesn't indicate anything about chest pain. So option 2 is correct. The ability to put on makeup without angina, those ADLs, activities of daily living, this indicates that the medication is working. And option 3 and 4 are incorrect here. So daily anxiety doesn't indicate anything for nitro. And option number 4, decreased systolic blood pressure, guys, it doesn't indicate anything about chest pain. So option 2 is our best option here. Okay, that wraps it up. Now, using our 3 steps, let's break this down. This question's asking for correct patient statements regarding the key problem, sublingual nitro tabs. So we're immediately thinking vasodilator, treatment of hypertension, and we give it under the tongue. So we think nitro is a vasodilator that lowers the blood pressure. And for nitro sublingual, only 3 pills max, taken 5 minutes apart. And we call 911 if the chest pain persists 5 minutes after the key number, the first dose. Not the third dose, but persistent chest pain after the first dose here. And then the no-nos of nitro. Guys, no swallowing. That's one of the biggest NCLEX tips. Sublingual means under the tongue, like a submarine. So under the lingual, under the tongues for sublingual. And then lastly, what kills the patient the fastest is afil drugs. So no drugs ending in afil, like sildenafil, that will kill the patient. We're talking blood pressure so low that the patient will die. So the solution we're looking for are remarks by the patient that are true regarding this medication. So option number 1 is correct here. 3 pills maximum. 1 pill every 5 minutes apart, PRN. Now that is appropriate. Now option 2 is incorrect. Nitro is not for headaches. It will actually even cause a headache. And option 3 and 4 are also incorrect here. So nitro should be kept near the patient at all times, but just not in the pocket, because putting inside the pocket will generate heat and degrade the medication. And option 4, also incorrect. No mixing nitro in sildenafil. Remember, sildenafil will kill profound hypotension and killing that patient. Okay, that wraps it up. For more details, now using our 3 steps, let's break this down. This question's asking for the most concerning thing to report to the HCP. For the key problem, administering labetalol, 100 milligrams. So let the name of the drug help you here. LOL ending drugs is for a beta blockers, putting the brakes on the heart. So LOL, we just think it lowers the double L's for the double cardiac vitals, heart and blood pressure. But beta blockers are really bad for asthmatic patients. So remember the 4 B's of beta blockers. So remember, B is for bradycardia and blood pressure. It lowers both of those. So we never give the drug to anyone who has low heart rate or low blood pressure. And we don't give the drug to the second B, which is bronchospasm. So it's bad for asthma and COPD patients. And the third B is it's bad for worsening heart failure patients. And then the fourth B is it's blood sugar masking. So it really masks the signs and symptoms of hypoglycemia with our diabetic patients. So we just have to watch them very, very closely. So the solutions we're looking for is a reason to avoid giving the drug. So option number 1 is incorrect. Tachycardia is the reason that we give the drug. Remember, beta blockers puts the brakes on the heart, slowing it down. Now, option number 2 is incorrect as well. Anxiety is not a reason here. So, option 3 is the most correct. Remember, beta blockers are bad for asthmatic patients because of bronchospasm. So, Even if you didn't know anything inside this question, just think about who's going to die first. And usually it's an airway problem. So asthmatic patients are a big risk for a swollen airway. They technically die first. Now, option number 4 is also incorrect here because hypertension is a reason why the patient is put on beta blockers. So remember, double L's for double lows, lowering both cardiac vitals, heart rate and blood pressure. Okay, that wraps it